Good afternoon, everybody. My name is Sam and this is Rose, and we're the Hume Aged and Disability Resource Nurses. Rose is going to introduce Kat shortly, but before we do and get onto today's topic, I'd like to begin by doing an acknowledgement of country. So we begin today by acknowledging the traditional custodians of the land in which we gather today, and I pay my respects to elders past and present. I extend the respect to Aboriginal and Torres Strait Islander peoples here that may be here today. Thank you very much. I'll pass you over to Rose now and she can introduce our guest speaker today.
Okay, well, I've just realised I haven't got anything planned specifically, but I'd like to introduce you all to Kat Watts. She's a powerhouse here in Wangaratta at in the palliative care, the community palliative care team. We love her to bits. And she's a palliative care social worker, and she's going to be talking to us today about bereavement. So I hope you find this session really helpful. If you stumble upon this video later on and you want to share it with your colleagues, please do. Okay, so take it away, Kat.
Thank you, Sam and Rose, for that very kind introduction as well, Rose, and the welcome. I feel like I went to a citizenship ceremony last night, Sam, so I've got all the welcomes of different cultures and First Nation, narratives in my head at the moment. It was really nice. My first citizenship ceremony was beautiful. My sister-in-law became an Australian citizen. It's exciting. Thank you for those who are joining now and for whoever else may see this at a later date. As Rose said, I'm the social worker on the palliative care team, the community palliative care team at North East Health Wangaratta. Part of my role is certainly working with patients and their families, but the other arm of my role is working within our bereavement support program. So that is where we continue to support family members, carers, significant others of the person who has died. So that may be just some check-in phone calls to see how they're getting on, or it may be a bit more intensive work around their grief and how they're coping and readjusting and transitioning to life without that person in their life anymore. So I'll talk about bereavement in relation to families that you might come across, and then I'll touch on colleagues as well, just at the end at the same time. So bereavement can be a confusing term for a lot of people, actually. They don't quite understand what it means. So bereavement's the experience of losing someone important to us. It's characterized by the grief. So that's the grief is the process and the range of emotions we go through as we're adjusting to that loss. And we know that losing someone important to us can be incredibly emotional. It's devastating for many people, partner, family member, friend, pet. It doesn't mean it always will be devastating though. I think that's important to remember. Whilst there might be feelings of sadness, there can also be a huge amount of relief, actually, when someone's experiencing or someone's bereaved. And if you think about yourself or family members that you've come across who've watched a loved one deteriorate over years with dementia, for example, their death can actually be a huge relief because that grief has been so prolonged for them. Same with, a long history of cancer treatment, deterioration, any kind of neurological disorder, so motor neuron disease, watching someone continue to deteriorate with that as well. So death can actually bring an immense amount of relief for some people, family members, including the people that are looking after them. They're watching them intimately often deteriorate as well. So it's particularly true if you haven't experienced bereavement yourself, that it can be quite a hard thing to deal with, a significant loss for someone you've cared for perhaps for a long time. And there's many different ways you can support someone who's bereaved. However, many of us can feel a bit fearful working with people who are grieving, or spending time with them, because we don't know what to say. We don't know what to do. It can feel uncomfortable, right? So you might be that person at work who avoids a family member in the corridor. I'm just going to duck into this person's room and I'm not going to continue walking down the corridor because that's just a bit hard for me right now. And there's no shame in that. That's okay. A lot of people feel really uncomfortable in this space. And that's because ultimately we as people want everyone to feel okay. We want people to be happy. We want that. It's not always possible. So hopefully this presentation will give you a few little tips on how to deal with that uncomfortableness, because it's normal. It's really common. There's a whole lot of images on this slide. And if you Google bereavement images, pretty much this is where I got all of these images from. This is what conjures up for people, obviously, I guess, in that space, what they might think of, what comes to mind. One of those images didn't come up when I Googled bereavement images. I'm not sure if any of you can guess which one.
I'm guessing the butterflies.
Surprisingly, the butterflies came up. The butterflies were there. Yeah, absolutely. No, it was actually the woman at the top who's, looks like she's yelling or screaming. That one didn't come up under bereavement. I had to source that one myself, which to me, I thought that was probably a pretty acceptable emotional reaction to grief. But no, there were a whole lot of doves and butterflies and tears and hands in, head in hands and that kind of thing. So I guess the point is that there's no script. Everyone's going to deal with their grief differently. Every bereaved person is going to react differently. So if you take nothing else from this presentation, I guess knowing that each individual is going to react differently. So how we support them is going to be slightly different for each person as well. Now, you probably don't want to hear that. You're probably like, just give me a one-shot, fire away. How do I do this? How do I support someone who's grieving? How do I do that? Just tell me how, one way. Well, actually, there is one way. There is absolutely one way. And it's just being there. Presentation done. That's it. Too simple, right? That's it. Literally, it's just being there for that person. And it does sound too simple. There's little nuances, and we will go over those as well. But ultimately, one of the most important things you can do for a grieving person is just to be there. Your support and caring presence, that being genuine, that's what's going to help them cope with any pain, any sadness they're feeling, anything like that. If you can't think of anything to say, a hug might be helpful. Yeah, you're going to check with them first. And you know what? You might not be a hugging person, and you might not know them well enough either. That might not be your go-to, and that's completely fine. Don't offer a hug if you're going to feel uncomfortable about it. That's not what I want you to do. What you might say instead of a hug, if you don't want to say anything at all, is, do you mind if I sit with you for a bit? Is that okay? That's all you have to do. Again, it's just being present. Being present allows them to feel safe. Someone's there, someone's helping to ground them in their emotions ultimately. Someone's sort of holding that space for them. And it means that they perhaps don't feel like they have to keep it together, so to speak, if someone's there with them. So yeah, I said that there's one sure shot fire way of supporting someone. Yeah, it's just being there. But on top of that, it's being a really good listener. A really good listener. Just take the time. Concentrate all of your efforts on listening carefully. Listen to them genuinely, without judgment, attempting to kind of put yourself where they are right now. So with some compassion. Don't interrupt conversation. Resist any urge to offer solutions to things. All right. Talking less. That's really hard to do for many people. Particularly when there's silence. It's really hard to not say anything. Our innate reaction to silence is, I got to feel it. There's got to be noise somewhere. We live and work in a fast-paced society these days, and there's generally always some kind of noise going on, right? So allowing for moments of silence and being really conscious about just being and reflecting is harder than it sounds. It does take concentration, and it is about genuinely wanting to be there and wanting to be present for that person.
Can I just interrupt for a sec?
Yeah.
Just on that, the silence. It occurs to me that you can actually be silent in your in what you're doing, in your behaviour, as well as silence, say not having sound. Because I think sometimes, yeah, we rush in with the tissue box, or the hug, or the pat on the knee, or the shoulder pat, or anything like that. And sometimes that can actually interrupt the flow of what's happening for them. And we come in trying to make them feel better, or trying to make ourselves feel better with the distraction. And I think sometimes that silence can be supported by just being silent completely, like just sit there and don't do anything. Don't just do something, sit there, rather than feeling like we have to, supply whatever it is. I just thought just occurred to me.
Yeah. And you're absolutely right, because just sitting there without even, like you say, the tap on the knee or the quick shoulder rub, that's still our effort in making ourselves feel better. Like, who's that for? Yes, okay, sure, we want to reassure and we want to comfort, but just sitting and being is so uncomfortable that we want to try and initiate even a gesture to make someone feel comfortable, or reassured or better. And it's actually not about making someone better. We're not going to make it better. Their loved ones died. We're not going to make it better. So certainly just sitting and being is really hard. I did query whether we try it now, whether I set the timer for like 30 seconds and see if anybody jumps in. But I feel like some people would probably just put themselves on mute, and then they would maybe end up talking to their person next to them or something like that. You can cheat pretty well when you're on screen like this. If I was in person, I think I probably would give it a go. But it is really hard, and you will generally see in a room, even if we were in person, if I was to say, all right, 30 seconds, let's just sit. You don't have to stare at me directly, because you wouldn't be doing that. You don't have to be, eyes locked on somebody, because that's unnatural. We're not going to do that. But I bet you after about 10, 15 seconds, someone's going to move significantly in their chair and move around, and because they're starting to feel a bit on edge, because it doesn't feel natural. And of course that would be a setup situation, but I think when you are just sitting with someone, you'll find that they will probably end up feeling the silence themselves, and they may say something that you can then respond to as well. But giving them the time to do that's really important. I think that's the next big step. So then they might say something, oh, what are we going to do now? because they're going to talk to us. They're going to tell us how they feel. Accept and acknowledge their feelings. That's what we're going to do. We're going to let them know that it's okay to cry if they're crying. It's okay not to. It's okay to be angry if they get angry. It's all right. It's okay to be distressed if they're getting, a bit worked up, a bit heightened. It can be really highly emotional. And they need to feel free to express their feelings. And that's the point of being present and holding the space and letting them feel safe. Then they will. Some people are really fiercely private and they'll hold their cards fairly close to their chest. And that's okay too, because what you've done at least is let them know that you're there by just being. And it is, we've heard this a lot, it's described as a roller coaster. And yeah, because it is. It is. And that's okay as well. That's what you can say to them. I know this is hard. There might be lots of feelings that you're experiencing right now. You don't have to try and name them. You don't try to have to, resolve them, but validating them and saying that's normal is a good thing. Someone who's just experienced a death may feel completely fine 1 minute and then really overcome by emotion the next. They might look on the surface like they are coping, and then all of a sudden it just comes out. It's just coming and there's no stopping. It's like a waterfall, a flood. And that's all normal as well. So letting them sit there, be present, acknowledging them. Yeah, I know this is really tough, but I'm here with you. That's all you have to do. That's all you have to say. I think normalizing it is the biggest thing for them. I've noticed when I'm following up with family members and calling them after their loved one has died, might be 2 weeks after, 6 weeks after, 12 weeks after, they will say, I feel like I'm going crazy. One day I feel like this, the next day I feel like this. I don't know where I'm at. I'm all scattered. I feel all over the place. That's normal. That's really normal. And as soon as you say that, they're like, oh, thank goodness. I thought there was something wrong with me. Thought I needed to go and see someone. No, this is just really tough. And it's really exhausting. Think about our emotions. We think about the emotions of happiness and joyfulness. They're really light emotions. You think of them already and it's like, sun's shining, I'm feeling light and bright, Think about emotions like sadness, and angst is like, straight away, you feel heavy. So I will often talk to people, and this is like weeks down the track, around the fact that emotions that you correlate with grief are heavy emotions. Physically, they feel heavy, and that's really exhausting. And that's really taxing when you've got things to do and you can't seem to get going and get done what you want to get done and function the way you usually would. It's because it's heavy going, literally. So taking the pressure off, trying to get all the things done is the best thing that people can do, and acknowledging that you're going to feel like that, and that's okay. That's all right. I really like this next slide. A bit of comedic relief here. Everyone's different. Everyone processes things differently. But nocturnal dog weeping is probably a favourite of many, up in the middle of the night with their pet and having a bit of a weep. Solo shoulder weeping, you might be on your own. Simple nude tree weeping, personal favourite. Primal levatorial sobbing. I think we could even sub in the shower from the bathroom. That's pretty common as well, really. Structured ceremonial group weeping. Yeah, that's generally a funeral, a memorial, that happens a lot, and is still very normal. The vague, ongoing, all-pervasive weeping. We just feel like particularly in the beginning, we are like this all day, every day, that kind of melancholy, if you like. The cold monastic candle weeping. Some people have got a really strong faith, and that's great for them, because often that is something that they can hold on to and keep them going. And then the deep rhythmic urban carpet sobbing, when it's all just too much, and you fall in the heap and curl up in the fetal position and let it go. So it's a bit of a laugh, the comics, but they actually speak to the way a lot of people process their grief. And they're all normal, other than maybe the simple nutrient weeping. No one's told me they've done that yet, but maybe it's the equivalent to the shower cry. I don't know. This can be hard for people, but let the bereaved talk about the death. Let them retell the story of how the person died. And they may say it over and over again. Some people go into great detail, and some people skirt over the surface. Some people will tell you what happened days or weeks leading up to the death. But that's a need that they have. And it's actually really common, incredibly common. As I said, part of my role in the bereavement support program, I'm now no longer surprised when I contact somebody for the first time after the person's died. It might be 2 weeks after. And they tell me every single detail. They go through it all as to what happened, the days leading up to it, like I said, even down to, their bladder and bowel output. They will tell me every single detail because they need to process it. And it's actually the retelling of what's occurred is incredibly restorative for that person. It speaks to what we call restorative therapy for many people as well. It helps them. When I say restorative, it's helping them to make some kind of meaning out of what happened, so to speak. They may ask you questions when they're retelling the story, I don't know really why that happened, or I'm not sure how that occurred, or maybe they should have done this, and well, what do you think? And your answers don't actually, unless they're quite clinical and they want it's a very direct clinical answer, and you can answer it, help them resolve that picture of what happened in terms of the process leading up to the person's death. But ultimately, you don't have to answer all those questions. You can say to them, well, I'm not sure. What do you think? Or if that's something that's really bothering you, perhaps I can help you find the answer to that question, particularly if it's a clinical question, or it might be a question that no one's ever going to be able to answer, what ifs. And you can say that to them as well. I don't know that anyone's going to be able to answer that for you. And that's really hard, isn't it? It's, again, just acknowledging the toughness of what they're going through, and that there may not be a really neat little story that they can box it up in. So the more someone tells their story, often they'll come to their own natural conclusions about things that generally can help them process what's happened for them. When that doesn't happen, that's when we would tend to then think about whether they're maybe experiencing some what we call complicated grief. So their grief's complicated by unresolved things for them, really. And you're generally not going to know if someone's experiencing what we call complicated grief until a good 4 to 6 months down the track, because it's all really hard in the beginning. Of course, it's going to be hard. But if they're becoming quite fixated on things and it's kind of preventing them from getting on with their day-to-day, and they're not sleeping and it's affecting their appetite and it's affecting their relationships with other people that they're close to, then that's when we would look at suggesting that they talk to someone about that, a grief and loss counsellor or a psychologist or something like that. But that's generally not the path you're going to go down in those initial stages after someone's died, because it's already it's going to be a blur, and they're going to feel a lot of different emotions from the get-go. So that takes a bit more time to assess. And if you're suspicious that that might be happening for someone, then the advice is to secondary consult with a grief and loss counsellor or a psychologist and say, look, I've got a patient, or I know a client, or I know someone that's experiencing this, and this is what I'm seeing and hearing. Do you think they need to talk to someone? And then it might be helping them to access their GP for a referral. But generally, repeating their story and telling it over and over is it's a good thing. It's normal, and incredibly restorative.
Kat, can I insert myself into the equation once more?
Absolutely.
Just on this, letting the bereaved talk about the death. I think part of it, well, for me personally, I know my experience is and continues to be, because we don't have any ritualized sort of processes around, oh, that person is great. So you've lost somebody, we don't have like the little Italian mama with the black dress on, or the black armbands. Often you could be walking through the street and not know that these people have just experienced the death of someone close to them. And so by telling the story, you sort of you're making sure that people don't forget what you're going through. And because we often tend to sort of sideline it, well, we won't bring it up with the person because we don't want to upset them. I mean, I didn't want to make you think about them as if you're not thinking about them. And so to allow people to talk and to just open up normal conversations and mention the person who died in the normal course of a conversation instead of sort of shying away and not mentioning it. I think that really helps then to bring that the loss into a normal experience for everybody in that person's circle, as well as because they're carrying it around with them all the time. And so to let the boundaries down between, say, me, I'm carrying this awful loss with me, but no one's talking to me about it, so I feel isolated from everyone around me because no one really sees what I'm going through, or it's this part of me that's not being acknowledged, and I can't express it because I don't want to upset everybody around me by being the Debbie Downer of the conversation. So I would invite anybody who's in the orbit of someone who's recently bereaved, or even, any of us, we've all lost somebody, to just get used to and become more comfortable with just talking about someone who's died as though they're still here, because for all of us that they do live within us.
Yeah,
yeah,
absolutely. And I think in speaking to that, saying the person's name, like actually saying their name when you are talking about them, you'd be surprised how many people have a conversation about the person that's died and actually never say their name. And it's a bit odd, really, but we somehow it does happen. We kind of talk around them rather than just about them. One of the best lines to, I guess, introduce them back into the conversation and remembering them is to use that word and sort of say, oh, remember when mum did this? And then you bring them back to life almost in their memory. We do the same thing for my grandmother, who died of dementia in January, and we did it just the other day. We we played cornhole. I don't know if anyone knows it, but it's an American game. There's a hole in a piece of wood, and you've got to try and throw the beanbag in the hole, like quoits, like effectively. Anyway, this game cornhole we played at Christmas just before my grandmother went into aged care. So she definitely, was not remembering things at all. For some reason, though, her hand-eye coordination was excellent. And out of all the 20 family members, she pretty much came down to the last 4. We're like, hang on a second, how does my grandmother do that? So it's like, remember when Gigi, she was a nickname, remember when Gigi did this? And it's a really nice way of talking about the person and keeping their memory alive. And yeah, it might bring a tear to your eye, but that's okay. That's all right, because the memory is there. And it normalizes again the fact that death and dying happens. It can't escape it. It's the way it is. So that's a really nice way to raise with someone if you're not quite sure how to remember when, because it generally will bring a smile to their face. And if that's what you're after, then that's generally what you're going to get as well. It's a nice way of doing it. So then offer comfort and reassurance in that time. This is your takeaway, ultimately, is be present. Tell them what they're feeling is okay. And just keep in mind that grief's individual, it's personal, and we need to respect their way of grieving, whatever that looks like. It may not make sense to us. It may not be our style, but it's theirs. And we certainly need to respect that. Some people are going to lean into feeling a bit angry, maybe about what's happened. And that's okay. I remember having a conversation with a gentleman who'd lost his wife, or his wife had died. And he said, I'm just so short with people. I don't know why, but I find myself being really short with people, and I just don't have time for it. And I said, you know what's happened here? Your life perspective has shifted. There's a change. And from what in the past you may have engaged in conversation, now you may see as, you know what, that's just really petty. I don't have time for that. You realize life's too short. Where am I going to put my energy? Where is worth putting my energy? And he's like, you're exactly right. He said, I'm finding that I'm getting really short with people and snappy about trivial things that people are raising with me. I said, well, you've kind of got a broader perspective now on life. And he's like, that's exactly what it is. So patience is a really hard thing to hold for people as well, when that's their experience of grief and that's what and you're maybe on the receiving end of that. Sometimes knowing it's not about you, it's about them and where they're at, and trying to understand that at the same time. And that can be really hard, because you're kind of reading between the lines there. And you can say to them, oh, you okay? You don't seem yourself. And I know what you're going through is tough. You want to talk about it, and then see what comes out of that. Again, just letting them know, I'm here for you. Need anything, I'm here for you. That's what you're looking at. So they're the tidbits of kind of what to do. We're being present, we're giving them space, we're normalizing and validating what's going on for them, and we're offering that reassurance. But what not to say? I think most of us know a lot of these statements. You don't really begin, at least you got to spend that last couple of days with them, or, you should have probably called that person and got them over. It's part of God's plan, everything's going to be okay. Look at what you have got. They're in a better place now, like all the platitudes. And we know that's because The people who are saying it are trying to make things better, and they don't know what else to say. So they're going to say that. And what are they doing? They're filling in the silence. They're filling in the silence with stuff, ultimately. Again, telling the person not to cry. Crying is really helpful. I don't know if any of you have had a really good cry, but it's actually, we do it for a reason. The body needs to release what's going on there. So that's okay. And, you know, rushing in and saying things like, oh, you know, this is all behind you now. You can get on with things. You know, that's really common if you think right back to the beginning, when you think about people who have been slowly deteriorating for a long time with a dementia or a cancer diagnosis, something like that. This is, you know, this has been a hard road. This is all behind you now, and you can look forward, and it's like still not particularly helpful. Sitting in the silence is probably more helpful than rushing in and saying things like that. These are all pretty obvious, but they still slip out. You know, we don't mean them to, but they slip out of people's mouths. And don't forget the ultimate. Oh, I know how you feel. Yeah, I remember when. That's a doozy, that one. Sure, you may have experienced a significant loss in your life. There may have been a death of a parent, a partner, a sibling, a child. But ultimately, your experience is different to their experience. So you don't understand. You don't understand what they're feeling. There might be a little bit of common ground, and that's useful in a bereavement support group, because you kind of all coming from a place of grief, but that's as far as it goes. You then come together to support each other in your grief. It's not because, oh yeah, I feel like, I know, I get it, I feel like that too. It's not about that at all. It's just that common ground of coming together because you're all experiencing grief and you're all bereaved. So saying, I know how you feel, actually invalidates what they're feeling. It doesn't validate it at all. So you're actually doing the opposite. So it's one to really be careful of. And it's, if you catch yourself doing it and it's already snuck out, so you know what, I'm actually really sorry. I shouldn't have said that. I shouldn't have said that. I don't know how you feel. I can maybe try and imagine, but I don't know how you feel. And just back the truck up a bit and try and smooth it over and start again. And you can be transparent about that and say, look, I actually really want to start again. I'm really sorry. I shouldn't have said that. That's okay. We're not going to get this perfectly right the first time around, the second time around, the third time around. It's not going to happen. This is a messy space. It's uncomfortable. There's emotions that we don't want to be feeling. We want to push away and smooth over. It's not going to happen like that. And so we've talked about family members. We've talked about, supporting people who are the family members or the friends or the carers or the significant others of the person that's died. But remember your colleagues, actually. You know, we're offering all this support to patients, their support, their people. What about our own people? You know, many of you will provide nursing care to patients for a really long time. It can be for a really long time. If you're in an aged care facility, gosh, you've got residents in there who have been in there for a really long time. So, yeah, and in that time, you develop your own relationships. And yeah, okay, it's a work relationship, it's a professional relationship, and that's how you like to see it as. However, in those exchanges that may be only small, but over the years, those really small exchanges that you have with those residents add up, and they develop a connection ultimately. And so we're people first, we're our profession second. So we can't help but have those connections with the people we're caring for. So acknowledging how you feel yourself when a patient dies, a resident dies, is something to really be aware of. And when I'm talking about that, I'm talking about reflective practice. How does that relationship, nurse-resident, nurse-patient relationship, impact upon me as a person, not necessarily as a nurse or a carer, a personal carer, but on me. So it is important to remember your colleagues and watch out for how they're coping, dependent on where they're at in their career and their own experience. You know, you may have some new grads working, or you may have a very well seasoned nurse, and they're going to react potentially quite different. And some people you might look at and go, oh no, they're indifferent, you know, they don't care and they're not sad. But it may just be the fact that they've been doing this for a really long time and they've been able to develop their own sort of strategies, self-care strategies. And on the flip side of that, it sounds awful to say, but sometimes we do become a bit desensitized to it as well. If you've been working in an aged care facility for a long time, potentially you've seen a lot of families come in and you've seen a lot of residents die whilst you've been there. They come in, they stay for a few years or stay for a few months and die and then go. So it sounds awful to say, but there is a level of desensitization to that. If you think about all the way back to 9/11, and all we were seeing for years after that was the war in Iraq and car bombings and suicide bombers. You know, that was on the news every single day for probably a good couple of years, actually. And it sounds really awful, but now when you hear about it, your initial reaction is not the same as when you first saw it on the news all those years ago, because there's a level of desensitization. You know, you might say, oh my gosh, that's just so awful, I can't imagine. But I remember my initial reaction all the way back then, and it was very different to how I react to it now, because I've seen it so many times and it's awful. It really is. I wish that I didn't have that desensitization to it, but I do. And it's the same for people who are working in an aged care facility for a really long time. If you see something over and over and over again, you know, your reaction to it's going to be a little duller, unless there's that one resident that just, you know, there was that connection with, you know, that bit deeper of a connection. Something was said, or there was, I don't know, like that cheeky grin that you remember, or the sparkle in their eye or whatever. And it's emotive then when you think about it, when you think about their death and them not being there anymore. So remember your colleagues. It's not just about the families. It's about the people you work with and looking after them too when they're feeling that grief and are bereaved as well. And that's really important. I'm not even sure of the time. Oh, nearly 10 to. So that all I've got left really is some resources. So the Australian Centre for Grief and Bereavement have recently developed a separate webpage, particularly for aged care grief, and that's aged care grief and bereavement support. So the details are there in terms of accessing them for support, and Griefline offer support for anyone in grief, and that might be regarding a family member, a friend, or even a pet. They're a bit broader in that respect. All of them, or both of them, offer telephone support and online counselling, and their websites are full of information. And they're the two places that I certainly direct any family members or to for additional support, as well as my own support to them over the phone or in person. So they're both excellent in that respect. They're the two that I would recommend. Of course, there's always Lifeline as well, but these two specifically for grief and bereavement. So yeah, that's where I'd send you to. But that's all I have for you today. I know we're cutting it not quite to the hour, but I thought I'd allow for questions if there were going to be any, just in case. So I hope you got something out of that.
Thank you so much, Kat. That's just, yeah, wonderful. I really love that. I'm going to stop the recording now.
Yeah.